Hello students, in this video lecture we are going to discuss about one of important topic that is mental retardation. In earlier time, mental retardation is also known as the Mongolism type idiocy, or it is also known as mental deficiency. It is also known as mental deficiency. Okay, the word meaning of the mental retardation, that means sub-average intellectual functioning. By that, the person is unable to do their day-to-day life activities, and this all are happens before the age of 18 years. That is called mental retardation. Okay. Next slide, we are just discussing some introduction part of the mental retardation. Here we mention that sub-average intellectual functioning because of the person is unable to do day-to-day life activity before age of 18. That is called the mental retardation. According to Diagnostic and Static Manual, uh, client must meet 3 criteria to diagnose the mental retardation. अगर इन 3 में से ये 3 criteria किसी patient में मिलते हैं, below 3 mentioned criteria if found in any patient, that we call the mental retarded person. These are, if the person have the IQ less than 70, that we will discuss later the what is IQ. आपने लास्ट ईयर अपने प्रीवियस क्लासेस में साइकोलॉजी के अंदर ये टॉपिक पढ़ा होगा आईक्यू का. जो आईक्यू लेस देन 70 होती है, दैट इज़ कंसीडर्ड अंडर द एमआर. ओके, अगर सेकंड पॉइंट आता है, सेकंड डायग्नोस्टिक क्राइटेरिया है कि इफ़ द पेशेंट डेफिशिएट इन एट लास्ट 2 अमंग ऑफ द फॉलोइंग, जो नीचे लिखी हुई इन द कम्युनिकेशन, in the self care, in the living, IPR, academic skills, health and safety, इनमें अगर किसी 2 क्राइटेरिया भी उसमें मिलते हैं, that means that person may have the mental retardation. और थर्ड क्राइटेरिया है, अगर उसकी एज कितनी है, 18 से कम है, that person may have the mental retardation. So 3 these criteria are IQ and these cognitive functionings and the age. These are 3 criteria according to DSM, Diagnostic and Static Manual, that is worldwide approval formula है. उसके लिए अगर if there is 3 deficiencies, 3 criteria, if someone is meet with these 3 criteria, that person having the MR. Now we are discussing some facts about the MR. These are, as I previously I told you that MR before 1870s, MR was known as mental deficiency. Okay, then 1877 John Down named as Mongolism type of, John Down नाम के एक साइकोलॉजिस्ट थे जिन्होंने इसको क्या कहा, मंगोलिज्म टाइप ऑफ इडियोसिटी. In 19th century, MR client termed as the idiot. Okay, IQ test developed by Binet and Simons. Binet and Simons ने IQ test develop किया था. According IQ test में क्या होता है, IQ equals to mental age upon chronological age 100. That is the formula that define your IQ. IQ that means intelligence quotient. ठीक है, इंटेलिजेंस क्वेश्चन इसमें क्या होता है, सम टाइप ऑफ क्वेश्चंस होते हैं, दैट इज रिगार्डिंग योर अवेयरनेस, रिगार्डिंग योर कॉग्निटिव फंक्शनिंग, दैट डिफाइन ए पेशेंट IQ. इफ योर IQ इज लेस देन 70, IQ is less than 70, that person is considered as MR. That test is developed by Binet and Simons. Okay, then next, according to the American Association of Mental Deficiency, a mental retardation refers to a significant sub-average Journal Intellectual Function. According to the AAMD, American Association of Mental Deficiency, MR can be classified into these categories, into four categories: mild, moderate, severe, and profound. If some person having the IQ range between 50 to 70, that person is considered educable MR or mild MR. If IQ is in range between the 50 to 70, that person is considered as a mild MR. Mild MR is also known as educable MR. Total cases of from all the cases, 80% of the cases are having the mild MR. Okay, these person are learn basic skills and able to educate up to the 5th to 6th standard. ठीक है, मॉडरेट एमआर होता है जिसकी रेंज होती है 35 टू 50 आईक्यू रेंज होती है. इसको हम दूसरा नाम बोलते हैं ट्रेनेबल एमआर. इज आल्सो नोन एज ट्रेनेबल एमआर. वी कैन ट्रेन इन सम स्किल्स. ओके, टोटल जो केसेस होते हैं एमआर के उनमें से इसका 10% पार्ट होता है. दीज कैन दैट पर्सन्स कैन बी एजुकेट अप टू द सेकेंड लेवल. सेकेंड क्लास तक पढ़ सकते हैं. लर्न कम्युनिकेशन, ये कम्युनिकेशन तो सीख सकते हैं, बातचीत कर सकते हैं. मीन्स मेंटेन सोशल रिलेशनशिप. सोशल स्किल्स, ऑक्यूपेशनल स्किल्स सीख सकते हैं. दे कैन वर्क बट दे नीडेड स्ट्रिक्टली सुपरविजन. दे कैन वर्क अंडर द सुपरविजन. देन नेक्स्ट कैटेगरी आती है सीवियर एमआर. जो एमआर की कैटेगरी है इसमें रेंज होती है आईक्यू की, दैट इज अप्रोक्स 25 to 35. Those patients are having the 25 to 35 IQ are considered as a severe MR, and these are known as the day trainable MR. Some confusion, if you have some confusion you can ask me anytime. Day trainable and trainable MR. Moderate MR is called the trainable MR and day trainable MR is called severe MR. Day trainable, that means have marked motor skills. ठीक है, they are having very less motor skills. They are very means they are not able to perform the daily activity even, but you can train them for a day. If you are trained this person for a day, next day you must require another training session for them. ठीक है, they have deficient communication skills, can eligible to start work but need strict supervision. आप उनको स्टेप बाय स्टेप अगर आप उनको क्या करते हैं, स्किल्ड करते हैं, ट्रेंड करते हैं, दे आर एबल टू परफॉर्म सम फंक्शंस बट नॉट कम्प्लीटली इंडिपेंडेंटली. आप उनको स्ट्रिक्ट सुपरविजन का ज़रूरी होता है. और टोटल परसेंट जो एमआर होता है उसमें 3 to 4% है जो वो सीवियर एमआर का पार्ट होता है. नेक्स्ट जो कैटेगरी आती है दैट इज़ प्रोफाउंड एमआर. इट इज़ सीरियस कैटेगरी जिसमें आईक्यू कितना होता है, बिलो 25, एंड 1 to 2% केसेस होते हैं. दे आर नॉट एबल टू ईट इंडिपेंडेंटली. दे कांट ड्रेस अप सेल्फ and they having the autistic behavior, means they are always in the dreamy state. They are thinking regarding the dreams. They are always talking about rootless talk. They have the maximum जो patient होते हैं, they having the brain pathology, means some problem is there in the brain tissue, and they are completely depends on other required hospitalization. They must be hospitalized or somewhere institutes में उनको रखना पड़ता है. They are completely depending even for the day to day life activity. They are depending on the others. These four category: mild, moderate and severe. Sometime examiner may ask you that कि dependable MR किसे कहते हैं? Which type of MR is considered as dependable MR? The profound MR category is considered as the dependable MR. Okay, trainable MR, moderate, and day trainable MR is considered severe MR. Next we are going to discuss about the causes which are relate with the which may cause the uh, which are having the etiology behind the MR. Most of the cases, near about the 75% cases, that does not have any type of etiology. And if we considered rather than that, 25% cases that having the genetic, uh, pregnancy, social, physical and other type of pathology that we considered one by one here. Genetic, if we are talking about the genetic pathology, genetic causes, this may consider the chromosomal abnormalities in which the patient may having the Down syndrome, Turner syndrome, clean Klinefelter syndrome. These all are considered as the chromosomal abnormality or genetic abnormality that may cause the MR. Some patients, those are having the inborn metabolic errors such as lipid metabolic disorder, uh, carbohydrate metabolic disorder, purine metabolic disorder. They can develop the uh, mental retardation. Second cause, the pregnancy related cause, that may be such as that causes pregnancy related causes may be categorized into three categories: prenatal, intranatal and postnatal. Prenatal causes are there. If we are consider that prenatal, that may be MR may be developed due to the radiation effect. Okay, if the patient if the mother is alcoholic, there are more chances the baby got the MR from the mother. And the maternal infections such as rubella, that may cause the mental retardation in child. IUGR, intrauterine growth retardation. Due to some abnormality, if mother having the IUGR, that patient may got that child may got the mental retardation. If we are talking about the intranatal cause, during the birth, if patient having some type of birth injuries, premature birth is there, if premature birth is there, and hypoxia, lack of oxygen is there, that these three type of intranatal problems that may cause the MR. And next we are talking about the postnatal. If the postnatal cerebral palsy, head injury, if the patient in the postnatal, the most common causes are related with the brain pathology, in which the patient may have neural tube defect, neonatal infection, CVA, head injury, cerebral palsy. These are the causes which are leads to the MR in the postnatal childs after the delivery. Some social cultural factors are there that may cause the mental retardation, such as early pregnancy, early marriage, early pregnancy have a greater role in the uh, mental retardation, and crowded environment that may also cause the mental. These are the subordinate etiology. If the patient has some physical problems such as brain pathology, that patient having the head injury, some type of if the patient having some related with the brain tissue injury, that type of condition may cause the mental retardation. Rather than that, so many causes which we are considered unknown etiology, that we considered in the other other causes of mental retardation. Most common cause or most common etiology of the mental retardation is Down syndrome. It is known as etiological MR, in which the patient having the IQ range near about 20 to 50. Okay, next, if we are talking about how we diagnose the mental retardation, we can diagnose the mental retardation by the DSM method, as we discussed earlier, in which we are discussed if the patient meets three criteria, in which we are considering that if the patient having the age below the 18 years, and second one is the patient IQ level less than 70. If some cognitive function which we are discussed earlier, if these functions are that patient shows that their functions are unable to fulfill their demands like communication, communication, living, self-care, IPR, academic skills, health and safety. If unable to meet these demands, that patient considered, that is the best way to identify the mental retardation. Rather than that, we can collect the history and physical examination, developmental screening, intellectual test, neurological examination, and other tests such like X-ray, ECG, thyroid study, chromosomal analysis. These are the diagnostic methods by which we can identify the mental retardation. Last but not the least, how we can manage the mental retardation. We can manage the mental retardation as different level of prevention, such as primary prevention, secondary prevention, and tertiary prevention. In the primary prevention, we can educate the community regarding the mental retardation, regarding the causes of mental retardation, and we can promote the community for the immunization, for the genetic counseling. These are genetic chromosomal screening. These are the primary prevention. By that, we can prevent the MR. In the secondary causes, we just identified as soon as early possible. We can detect the cases and start the treatment for that. And in the tertiary prevention, if patient got the MR, got the mental retardation, how we can treat them? We can treat them by the rehabilitation services, by the hospitalization, by the institutionalization. We can promote the patient living. We can standard up that the mental retarded patients living. We can perform the parental counseling, and we can suggest them, if the patient, their child having the profound MR, we can suggest them to hospitalize that or institutionalize that patients. We can provide some behavioral techniques, behavioral modification therapy to the patient. Specific services, if we are discussing about that, behavioral modification, learning disability, regarding the mental retardation, these are considered early detection of learning disability. We just find out how much the patient having the learning difficulty. We just we can promote that mental retardation patients in the hospitalization or special type of schooling, in which we can promote their life standards. Like regular assessment of a child for the MR. Next, in the specific services, we consider the prenatal and postnatal care services for the mother, and advice, support, and other measures for the patient, for their family. Compulsory education training. As we know that as according to our constitution, education is a moral right of everyone. We can so the mental retarded patient also having the rights for education. So we provide some special type of training, we provide some special type of education to them to standard up for their daily life activities and the standard of their living. So it's all about the mental retardation. If you have some type of difficulty, you can ask me. Thank you watching this video. You must kept your notes during the study, and must be, if you like that video, you can subscribe, like my channel. Thank you very much. Thank you.